Hello, everyone, and welcome to Zoom into Wellness. As many of you know, we have been having the Zoom into Wellness programs throughout 2020 and now into 2021 as a response to the COVID pandemic. We really feel it's been necessary to find ways to connect with others, find ways to make sure we reinforce ways that we can stay healthy and that we can be in touch with our community. And while COVID has created many challenges for both our physical and mental health, we want you to know that you're not alone, and we will be here with you each step of the way to help you achieve your greatest wellness. And so thank you for joining us tonight. I'm delighted to have Maria Gonzalez with us tonight. Maria Gonzalez is a licensed clinical social worker who I have the luxury of working with at Solano County Family Health Services. She's actually got more than 10 years experience in this field, including working with early childhood health, schools, juvenile hall, foster families, and now an integrated behavioral health services within the primary care setting. And I can tell you that personally, our patients have benefited greatly from incorporating her services into our care today. So we're really glad you're here today to talk about the interface of mental health as it relates to diabetes and metabolic syndrome.
Well, thank you for having me here.
Yes, thank you. I'm also happy to introduce Dominic Sam. Dominic Sam is a student at Touro University, getting his master's of medical health sciences, and has been an active member in this Zoom into Wellness series, learning everything he can about diabetes and knowing the importance as it relates to all of our practices moving forward. And he'll serve as our moderator tonight. So that being said, I want to remind everyone in the audience that we would welcome for you to put your questions into the Q&A session. I will remind everyone that this will be recorded and will be posted on the MOBIC and Zoom into Wellness website. And please go to that website to see our other seminars. With that being said, let's talk a little bit about mental health. So this is Mental Health Month, and I know that you've had a wealth of experience in mental health across many settings. What are the common mental health problems that you see as part of an integrated primary care center? What are the things you typically experience and treat?
One of the biggest things that I've been seeing, especially a lot more recently, and probably throughout the years of my work, has been anxiety. So many, from young kids to adults to families, anxiety, depression, grief. Especially during this past year, we've had a tremendous amount of grief associated from grief of lost loved ones, grief of loss of income, loss of jobs. There's just been so many people experiencing so much grief in the past year.
Yes. Yeah, and it's really been quite dramatic. I find that California is in some respects even more dramatic than other places because so many people have unstable living situations and really can lose a lot quite quickly, even pre-pandemic.
Yeah, which results in much more ongoing distress, the anxiety of not knowing where they're going to live or how they're going to pay their bills. So just an increased amount of emotional stress for so many of our patients and for the clients we see.
Yeah. So, a lot of this program has been focused around diabetes and diabetes-related complications. Do you see different types of mental health disorders in those patients who have diabetes as well?
I think mostly coming from integrated behavioral health, I would say that the most common thing that I see is anxiety and depression. Obviously, there are other mental health disorders that come across as well, but I would say that most of my patients would present a lot more with anxiety and depression, maybe, and some trauma.
Sure. And how would a mental health diagnosis or experience affect the ability of someone to do the diabetes work they need to do?
think when a patient is experiencing anxiety, anxiety is, is a fear of something. It's a fear of having fear of having something that, whether it's real or unreal, fear, worries about their health. And so when they're very focused on their anxiety and their fear of the unknown or fear of their health, then they aren't able to really focus on their health, because they're worrying about tomorrow. They're worrying about all these other stressors, which really makes it difficult for them to focus on what they need to do to take care of their health, their diabetes, their healthy diet, even checking their sugar levels. And in some situations, a lot of the patients that I see sometimes don't have stable living situations. And so that increases their anxiety level, and that makes it a lot harder for them to focus on their health.
Yeah, it's hard to do kind of self-care behaviors when you're feeling unsafe in your own body at any given time, right?
Yeah. Yes. So part of my work with, a lot of the patients that do, that do present with anxiety is really helping them, teaching them how to work on their self-care, teaching them coping strategies to decrease the anxious thoughts, teaching them how to help them relax their own body and mind so that they are able to focus on their health. Because if they're focusing on their anxious thoughts, they're not going to be able to do what they need to do in the moment for themselves, and they're focused on their self-care.
So let's say that we see someone who we think has anxiety. Is that something that people will readily endorse? How do the people identify that they have it? Because often I think there's a stigma and there's a concern about having a mental health diagnosis. Is that something you experience, or by the time they see you, they've identified this and they're ready to act?
No, there's definitely a stigma in regards to seeing a mental health therapist. Most patients, they don't, the common thing with a lot of patients is, I'm not crazy. Why do I need to see you? And so there's definitely a big stigma in regards to seeing some mental health therapists. And many of them don't acknowledge or know that they have anxiety. So there's a lot of psychoeducation of what anxiety is, because a lot of anxiety can manifest in physical symptoms. And so the physical symptoms, many patients would think that the physical symptoms are related to health issues. And so it is a psychoeducation, because there is this thing regarding some of those physical symptoms can be health related, but oftentimes it's that education to teach them that those physical symptoms can be associated with their anxiety, that come from, their own worries about their health or whatever fear-based thoughts that they may be having.
And that could be rather confusing, couldn't it? Right? I mean, I feel chest pain, I feel pressure. How do I know if it's my heart or if it's anxiety? So I think it's pretty easy to see where that would be really confusing and hard for a client or a patient.
Yeah, because a lot of the, like you said, Dr. Sherbrooke, a lot of the symptoms, anxiety symptoms that manifest into physical symptoms would be the muscle tension, chest pain, shortness of breath, difficult controlling their breathing, shaking, chills, numbness. A lot of those physical symptoms can be anxiety-based symptoms. And so it's really helping them different. It's really giving them the space to kind of process what they may be experiencing, and then kind of building that rapport to helping them understand, to learning if there's any other stressors that may be going on in their life that are contributing to these physical symptoms. A lot of my patients have been seeing providers, and they've done all the blood work and they've done all the testing to kind of rule out medical symptoms. So the great thing about being with integrated behavioral health is that we get to connect with the providers and really help patients understand that the medical symptoms have been ruled out, and helping understand that these symptoms, although they maybe appear to be health related, can also be anxiety based.
Yeah. And I like what you just said there. And I guess I would kind of give my own plug that as a healthcare provider, we do our patients a service, a true service, if we let them know early on that we think someone has anxiety or they have depression. Because too often I think we say, oh, you have these symptoms, we'll make sure it's not your heart. And then after all the tests are negative, then we say, oh, you must have anxiety. And I feel like that could also be unsettling for my patient, because they think, well, they're like, where's the test that says I have that? And I think that, I personally, I like to say, hey, I think you're having anxiety, but I'd like to make sure this is not your heart. And so by doing it that way, when the test comes back negative for their heart, that's good news, it's not their heart, but it also reaffirms that I thought they had anxiety up front. And I think that too often we don't make a diagnosis, which I think gives good clarity for our patients.
Because you guys often don't make a diagnosis. Well, because you guys often will refer them to us, and then we have a conversation. And it's really kind of, I think, what helps reduce the stigma is that when I'm meeting with my patients, I'm having a conversation of what they may be experiencing, and then really kind of helping, educating them on what the symptoms of anxiety would be and really kind of, rather than I'm not giving them a diagnosis, I'm just providing them this education and opening this door to this is what anxiety looks like. And so sometimes even when I open that door to this is what anxiety looks like, and maybe give them a handout of what anxiety looks like, or maybe help them understand, and by explaining that to them, and then, having them come back to see me and just allowing them to process that information really helps them it kind of reduces the stigma, because I'm just kind of giving them that education, that information. I'm not saying they have anxiety, I'm just opening up that conversation.
Yeah, and that really, I think, is good to let people kind of acknowledge that themselves, oh, this really does make sense, rather than being told. How about depression? So depression is something we see a lot in our practice. Is this something that patients would commonly see you for, and how does that interface with other chronic conditions?
Depression is definitely something patients see me for, and those are the depression are the patients that often isolate themselves more often. And so the patients that maybe experience depression, they're probably the patients that are most inconsistent with my appointments, because they feel so sad and they feel so down. They really have a hard time even making it to the appointments.
And I think that withdrawal is a big part of depression.
Yeah, withdrawal, socialization, like lack of social support, and many patients with depression, feel suicidal, have thoughts of hurting themselves. They feel so down, they're just not doing the things that they used to do, which is currently a big common thing going on now, because so many of our young children, we're so used to going to school and socializing with friends, a lot of them are now coming to see me because they're feeling down, because they're not socializing with friends. They're not out playing sports. They're not doing the things that they used to be doing, which is causing them to feel very down. They don't know that they're depressed, but they just don't feel like they used to feel. They just don't feel happy.
Sure. So let's say that a patient is listening, or a family member of someone is listening, and there's concern about depression. How can someone learn more about whether they truly meet the criteria for clinical depression and should get some kind of treatment?
Well, I would ask them some specific questions to see if they meet the criteria, whether or not, how often do they feel depressed? How often do they lack interest in doing the things that they used to do? I would assess like their appetite. I would assess their sleep routine. I would assess if they have, thoughts of hurting themselves. So to be clinically diagnosed, then we would have to do an assessment, and they would have to meet all those criteria, because there could be a mild sense of depression or major depression disorder. So not every patient's going to meet that clinical diagnosis, but may have some symptoms.
And are these conditions treatable? You talked a lot about depression and anxiety. They're treatable?
Yes, they are.
And how do people treat them?
So they would come to see a therapist, which would be me, someone like me, a licensed clinical social worker, that they could be referred to. In a primary care setting, they tend to be referred to by their medical providers. But there are other ways to be referred to mental health therapists out in the community. And so the best thing would be to refer someone to a mental health therapist for them to do an assessment and see if they meet the criteria for anxiety or depression, and then engage in therapy services. And therapy services would be to work on, for anxiety and depression, would be to work on building upon their coping strategies, helping them build upon their social supports, maybe community resources that are out in the community, maybe building relationships. Maybe the depression's caused by a strained relationship or conflict in the family by mom or dad or siblings, or so it could be working on those relationships. And if we improve those relationships, patients are not going to feel as stressed and are not going to feel as sad because of the situation that's going on.
And so this is something that's readily available to many people.
It's available to many. Yeah. Yes. Most patients can receive services. You can go through your medical provider, so your insurance. If patients are uninsured, and they are able to get services through a federally qualified health center, like Solano County has Family Health Services, but throughout many counties, there are federally qualified health centers where uninsured can receive services. They can see a medical provider, and then most of them, a federally qualified health center has to have a licensed clinical social worker as well. So if there are concerns of depression, anxiety, they can be referred to a behavioral health clinician within that healthcare setting.
Yeah, and as I mentioned before, I'm so grateful for you there, because there's so many patients that you're able to help. And for those that have not yet had an experience with a mental health provider, we talk a lot about depression has multiple different types of treatments, and all of them can work. And the good news is you have some choices. But I think that one thing that's not commonly known for many people is that, behavioral therapy is as effective as medication in depression, and often more effective than medication in anxiety. And it doesn't have side effects. And so while we often look for medications to be one of the treatments, there are non-medication options that are very effective and, are available. But I think that we just need to make sure that we communicate them so people know what to expect.
Yeah. So yes, I would say that therapy is just as effective as medication, especially if you look into the research. Cognitive behavioral therapy can be just as effective or more effective, because we're really working through really understanding patients' thought patterns, behaviors, symptoms, in order to really kind of help them build upon the appropriate coping strategies.
Thank you. Yes. So I have one question, and I want to offer to the community. If you have questions, please type them into the chat. So I'd be curious to hear about your experience of how either race or ethnicity is involved in someone's experience of a mental health disorder or their approach to the evaluation and treatment. Do you see differences? Are there things that we should be knowledgeable about? I realize that every person is different, so there's not going to be a single rule, but at least my experience has been that our approach to mental health has been a bit different amongst different ethnic groups.
Yeah, I think there are many ethnic groups that really don't seek mental health services or really understand mental health services. So I think that there are some groups that really present more with physical symptoms, for physical symptoms, and so that's what we have to be kind of more aware of is really helping understand that their physical symptoms may present a mental health symptom, and they're not going to be as likely to seek out services if we don't are aware, mindful of that.
Sure. So like, for example, fatigue or insomnia or hypersomnia, which means too much sleep, or just generalized pain, all could be a sign or a symptom of a mental health problem. Is that what you're saying?
Yes, yes. And they won't reach out to mental health. They won't seek out mental health services. They'll seek out, medical services. And so that's one of the common things. And so referring them, if it's not associated to health, then referring them to therapy, to a mental health provider is appropriate. But I think we also need to be mindful that it's important that there are, that they can be seen by the appropriate person that will be able to address like their cultural needs. I think from my experience, I do provide services to the Latino Hispanic population. And I think that's been one of the things that has really been helpful is that when patients are referred to me, I speak Spanish, I can understand them, I could relate to them in a different way that someone else may not be able to. And that allows them to continue to see me and to want the support. And sometimes it can be a barrier with other ethnicities. And I, as long as I am mindful and educated about that cultural and how to meet I'm able to meet their needs. But if I feel that sometimes I may want to refer them out to someone that may understand them and can meet their needs more efficiently.
Yeah, what an important point. And I think you brought up a couple of things I want to make sure I highlight. So if you're feeling physical symptoms, and it would be obvious for you to say, if I have a headache, I should go see a doctor. But it really is on the doctor or the healthcare provider's kind of responsibility to say, hey, this also could be mental health. And no, I'm not going to just wave it off. I'm going to assess you and say, is this a medical problem? Is this a mental health problem? Or is it both? And then get you to the right treatment options. So I guess I want to make sure I highlight that it makes sense that you would seek medical care if you had a bodily problem. But I think in this session, we're trying to highlight that you can have a lot of different symptoms for anxiety or depression. And some of them might be really clear that they feel like your mind is racing. And sometimes it could feel very physical. And that doesn't mean it's better or worse. It just is another manifestation of a mental health condition that can be treated.
Yeah.
And I do appreciate that also working in family health services. And I love working there and I love seeing the diversity that we see in our patients. But there is a connection, right? You do make a connection with your providers, and that connection could be on a lot of different levels. And sometimes things that are intimate as behavioral therapy, sometimes having someone that has a similar background or similar life experience could be very valuable. But that doesn't mean that's the only way you could connect with someone.
But I also think that that's an important part is that our patients, like working at family health services, do have a very good connection with the medical providers. And then when you have someone that, like me, like within behavioral health, and we do a warm handoff, which means that the medical provider introduces me, allowing and saying, this is someone, let's just, we would like for you to talk to and explore more that this physical symptom may be associated with something else. The medical provider continues to roll out the health, anything that may be health related, while they connect them to behavioral health therapists that can continue to provide support and assess if this physical symptom is associated to anxiety, depression, or any other mental health diagnosis.
Thank you.
So we do have a question from the audience. It says, is there any research showing that it's been more beneficial for diabetic patients to utilize CBT over psychotropic meds, or does it depend on the level of the psychiatric diagnosis / diabetes?
I don't know if there's been any clinical research in regards specifically to diabetes patients. I just know that CBT, cognitive behavioral therapy, has been shown to be very effective, more effective than psychotropic meds.
And I can add something to that. I can't speak to a lot of things, but I can speak to this. I was actually an investigator of an NIH-funded trial for people with type 2 diabetes and moderate to severe depression. So this was not mild depression. These were people that had clinically diagnosed moderate to severe chronic depression. And they were in a study where the 4 treatments arms were just cognitive behavior therapy or exercise or the combination or routine care, which was whatever the healthcare provider decided, which was usually medication. And what we found is that in moderate depression, all 4 arms were about the same. If you engaged in some treatment, you got benefit. The one arm that did best was the combination of structure, exercise, and cognitive behavior therapy across all groups. So if I had to pick one winner, engaging in regular cognitive behavior therapy, which is regular counseling, these were weekly sessions, and structured physical activity, which was actually supervised, those patients not only did the best in terms of symptoms, they had the longest duration of periods of times where we call they were in remission or less clinical depression. So, and they were better than meds. So, which was back to my original point, is that these are things that are at our fingertips and are excellent treatments. I didn't post that question, by the way. I didn't.
Wow, that's amazing. How long do a patient has to be on cognitive behavioral therapy, like on average, for them to like alleviate the symptoms of like depression and anxiety?
I mean, I think most intense, true cognitive behavioral therapy sessions could last up to 6 to 18 sessions. So it's short-term therapy. I think every patient would be different. But if it's 6 to 12 sessions, a couple booster sessions, if a patient truly is engaged and goes on a weekly basis and is able to, do the program, they can make progress probably towards the end of the treatment.
Have you seen like patients who like are starting to get compliant with the CBT therapy, but then they drop out? Like, what do you recommend or advise them to do if they are not compliant with the treatment?
So the only time that I did true CBT therapy is when I worked with postpartum. It was postpartum depression. So we did a therapy base. I was 12 sessions. And so it did after about the 6th session, midway through the session, people started to not engage because it consists of, when you do cognitive behavioral therapy, structured, it requires the patients doing the homework and doing kind of their own work in order to make progress. And so when you get to kind of the middle part of the session where you are challenging patients to do their own work, that's when you see patients drop out of treatment. And that's, you know, you have, and in order to re-engage them is to really kind of do some kind of motivation interviewing, kind of to see where they're at. Maybe it means kind of structuring the homework that meets better their needs. Maybe it means kind of maybe changing sessions. So maybe you have to, maybe working towards changing some of the exercises to meet their needs, if it's available in the structured program.
Yeah, that's a great, like, excellent advice. I do have another question from the audience. So it says, some people stress eat and this can like exacerbates the condition. What's the best, most respectful approach to reaching out to a loved one who stress eats?
I think it's kind of a hard question to ask, because we would want to understand what's the underlying factor and what may be contributing to the stress eating, because there could be a lot of different reasons, a lot of different things that may be contributing to the stress eating. So I guess I would have a hard time answering that, because it's very individualized, and I guess it would really depend on what may be contributing to the stress eating.
And maybe, Maria, you could comment on this. So often we have behaviors that are coupled behaviors. And so it's, you know, like stressing, you can have an eating disorder by itself, or you could have depression that manifests as an eating disorder. And so often it's kind of trying to get at the bottom. What's the source? What are you trying to feed if stress eating was the factor? And you know, it could be a million different behaviors. But I think because so many behaviors are coupled, and when you're in the middle of it, I think it's hard to see it yourself, right? It's hard to see the forest through the trees. And that's where that objective kind of third party can be so helpful to see, like, do you notice this is what happens? Like maybe we can kind of see the signs that this might start to happen, and maybe we could disrupt that behavior cycle. Does that sound fair, Maria?
Yes, yes. That's right, because a lot of those behaviors could be contributing to lots of different things. And so, yeah, so having them seeing a therapist would really put in a third party perspective.
So I have another question while Dominic's collecting questions. I know that around the nation, there's a significant shortage of mental health providers. And I would say that in addition to that, one of the comments in our chat is there's a lack of diversity in our mental health providers as it matches our community. So I don't know that you have an answer, but let's just say that someone doesn't have the luxury to be at a federally qualified health center, which to me, I think is very nice to have comprehensive care. Where could someone seek out mental health providers? If you have any suggestions at all. I have one suggestion, and I guess I'll say that first, is the American Diabetes Association has developed a mental health network. And so you could actually go online to the American Diabetes Association, and it does have a list of mental health providers experienced in diabetes. But this is not unique to diabetes. This is a problem all over the country. So do you have any suggestions how someone could access mental health or find a mental health provider?
I know that most counties have like an access line, a mental health access line, like Solano County and many other counties would have an access line. I think that would be a good start with maybe reaching out to the mental health access line in your county for resources that are available to you within your community.
Great. So how would they find that?
Solano County has it's called Solano County Mental Health Access Lines. You could probably go online and on the Solano County website, and you would be able to see the phone number for the access line. I don't know if there's anything specifically like any national website for providers. I guess I'm just so stuck with the resources with the community that I work with. That's really all that I know.
Okay, thank you. And so I guess one other question I have, and it looks like Dom may have another question as well. In Solano County, we have a hot line and we have a cold line, a warm line. Are you familiar with the warm line? This was something that was brand new to me. I didn't actually know about it.
Yeah, the warm line. The warm line came up when COVID started, just so that we have more kind of where patients wanted to have more support since we were all going through a tough time. So the warm line helps, kind of provide resources during this pandemic.
Okay, so if you're not quite in a emergency situation, and thank you, Dominic, for putting on the helpline. So there is a national 1-800 helpline. So if you ever feel like you're at danger for yourself, like you're going to hurt yourself or someone else, or you have a family member or loved one who is, if someone calls this number, there are experienced health professionals that can help you get through this crisis. This is not intended to be routine cognitive behavior therapy or even therapy. This is really more focused on this emergency setting. And I think that while that's not the focus today, I think we'd be remiss if we didn't at least put that number out and say, you have a number, and I can tell you I have personal experience with this number. You have someone that can help you in the middle of a major crisis get through it. And I would encourage every person who knows someone with anxiety or depression and every healthcare provider to know this number. And it looks like you've put in the Solano County number as well. Thank you.
Yeah, thank you.
I just have one more. Yeah, so, as a patient myself, I had trouble like understanding what a licensed clinical social worker versus a behavioral therapist. I know we talked about this earlier, but for the people in the audience, can you elaborate like the difference?
So I think behavioral health therapist has been a term that we shifted to it the last couple of years to kind of reduce the stigma. So if we're seeing a behavioral health therapist versus a mental health therapist, it just helps we're working on behaviors, and we're not specifically we're not saying you have a mental health diagnosis. And so I think it's helped just to kind of reduce the stigma. But a licensed clinical social worker, it's what my title is, but in the clinic, I'm a behavioral health therapist just because I want patients to feel comfortable coming to see me.
Thank you for
that. Does that help? Yeah. Does that help clarify the question?
Yes. And then from our audience, we're saying that, you can also Google psychology and like find a list of areas of psychologists along with their bio if you're looking for someone in particular for mental health help. And also in the chat, we see that there is some videos and future programs on the website listed on the chat. Yeah, I don't see any more questions. Dr.
So Maria, what are the kind of 3 things that you'd want to make sure the public knows about mental health as the summary here today?
I think if you're feeling like you're experiencing any symptoms during this time, if you're feeling down or isolation or having physical symptoms, just go talk to someone and see if it is associated with anxiety or depression or something. Going to talk to someone just to kind of, seek out support, work on your self-care, work on, taking care of yourself. So if you're feeling anything may be happening, go check in with somebody.
And that's so important, because I think that people think that they're going to be stuck with these feelings, that they're going to have them forever. And probably the one thing that is universal is that they change. They'll wax and they'll wane. So you don't have to live this way. And there are very effective treatments, and that doesn't always mean medication. So very important. I don't know, and I haven't heard you say this, but I've heard a lot of mental health providers say that if you've not been severely distressed by the last year, you probably have a problem, because we have had probably one of the hardest years of our life between social unrest, political unrest, significant financial stressors. Oh, and then we had a pandemic. These are really challenging times, and it's important for us to know that we're not doing it alone, and that there are really important available resources for us waiting to help us. So we so appreciate what you do. We so appreciate what you do for the patients at Family Health Services. And thank you for joining us tonight.
Thank you for having me.
And to our viewers, we've put into the chat our website as well as the Zoom into Wellness links. Please feel free to join us. Our next program will be actually next Monday. Shalaya will be back and she'll be leading a discussion. Oh, that's not true. Dr. Young will be back next week, and he'll be joining us, leading us through a discussion of how do we address and treat high cholesterol and diabetes. So thank you, Dominic. Thank you, Maria. We're so glad you're here. Thank you for the audience. And we hope you continue to Zoom into wellness. Take care of yourself. You're not alone. We look forward to seeing you for a healthy 2021.